Malaria is a disease that is transmitted by mosquitoes. It is a preventable disease that can lead to death when the necessary precautions are not taken.
These are words of the Member of the Parliament from Mchinga, Her Excellency Salma Rashid Kikwete, also wife of a former president of Tanzania, His Excellency Jakaya Mrisho Kikwete, a champion in the fight against malaria in Tanzania. In an effort to continue advancing the fight against malaria, Tanzania's Ministry of Health, through the National Malaria Control Program, trained members of the parliament on how to access malaria data through a tool called Malaria Scorecard. By providing access of data for key malaria indicators, members of the parliament are informed on malaria situation in their constituencies and more empowered to support malaria interventions. For example, the Malaria Scorecard indicators shows whether enough people are receiving mosquito nets, getting tested of malaria, and receiving anti-malaria medicine when they are sick. When the scorecard indicator shows underperformance, action must be taken to make the situation better. The scorecard is produced by the National Malaria Program every quarter using the data reported by health facilities. The scorecard assigns a color green, yellow, or red to each data value based on the performance. The colors make it very simple for all people to interpret the data to know how they are performing in their councils. Dr. Samuel Lazaro, the Deputy Program Manager of the National Malaria Control Program, explains why the government saw the need to train members of the parliament on the scorecard.
We decided to use the malaria scorecard with the objective of increasing the malaria knowledge among our political leaders. As we're all aware that political leaders have a lot of influence on people since they have been elected and are trusted by the people. For Tanzania to achieve malaria elimination, there is no other way other than to involve our political leaders so that they can help in mobilizing support for the implementation of various malaria interventions.
The coordinator for malaria and other vector-borne diseases from the President's Office, Regional Administration and Local Government, PURALD, Stella Kajange, further explains the importance of training members of the parliament on the scorecard.
The scorecard is very essential in monitoring indicators that are important to fighting against malaria. This scorecard will be helpful to leaders at all levels, from the national, regional, and council levels, but also to members of parliament. The scorecard tools alert people about the performance of an indicator by using colors. A green color is used to show the target has been achieved or implementation is on track to meet the target. The yellow color is indicative of progress, but it means more effort is required to reach the required level. A red color is indicative of danger, that an indicator is not on track to meet the target. When a leader sees the scorecard with these color codes, it can compel them to take action and follow up on the challenges that are hindering attainment of the target score.
Members of Parliament of Tanzania share their thoughts on the importance of training and how it will help them to lead the fight against malaria.
The scorecard training is absolutely timely. Everyone must be dedicated to make sure that they take this message to their constituencies. The training is important for us as representatives of the people. The malaria scorecard has made it easy for us to access information, so we know the situation of malaria in our regions and constituencies, even at the ward level.
The fact that I can know the situation of malaria in my constituency and also compare it to other areas in the country makes this a priority tool in decision making, such as allocating the sufficient funds and making follow-up on what needs to be done to progress.
Malaria data from the mainland Tanzania show that in 2020, nearby 6 million people suffered from malaria, and among them, 2,460 people died. Her Excellency Salma Kikwete describes the impact of malaria in her constituency.
Malaria inaua wakina mama,
Malaria is taking the lives of pregnant women, children, and others. But a lot of deaths are observed among women and children. For example, in Lindi region, 42% of patients are diagnosed with malaria. This is not a small fraction, and we must take action to make sure that we eliminate malaria.
What are the expectations of the government following the training of members of the parliament on the importance of malaria scorecard? Dr. Samuel Lazaro explains.
We would like all the stakeholders of malaria to use malaria scorecard. Training has already been conducted with health teams and leaders in 5 regions with the highest malaria transmission rate, but also trained all regions' malaria coordinators in the mainland regions. Though much effort has been spent in training the 5 regions with highest malaria transmission rates, the malaria scorecard is also used in other regions. We shall keep supporting more regions as we get more resources.
Leaders at all levels should use the scorecard effectively. That will be very helpful to us. The scorecard can be accessed via a computer and even through your mobile phone. One can access it daily from anywhere to access how malaria interventions are performing at the constituency level.
After the training, members of the parliament expressed that they are now empowered to participate in the fight against malaria.
We as representatives must continue motivating people to get tested, use medication, as well as tools such as bed nets to reduce transmission of malaria. Together with other preventive methods such as spraying of insecticides, I believe that one region will be able to reduce malaria by a big fraction.
We will educate the Council of Councillors on the scorecard, but also use it at public meetings, since we are now aware of indicators and how we can be of help to those areas in controlling malaria. I think education is a good preventive tool.
If we were able to reduce HIV/AIDS, we are now at 0.3%. Why can't we eliminate malaria? Let us fulfill our responsibilities.
The fight against malaria requires a united effort by involving all stakeholders in supporting the various malaria interventions. Stella Kajange explains.
The fight against malaria is not only for a few individuals, but it is for all. As the campaign slogan says, "Zero malaria starts with me." Let us all unite in the fight against malaria. If this is done, we'll be able to achieve the national goal of eliminating malaria by 2030.